Picture this, a simple snack choice that could transform your health as you age. For those over 65, the nuts you choose can make a world of difference, and today, we're diving deep into this topic to keep you informed and empowered. Groundbreaking research, like studies from the Journal of the American College of Cardiology, reveals that picking the wrong nuts might quietly increase heart-related risks. This is especially true for seniors, as some pantry staples, often hailed as healthy, could contribute to issues like high blood pressure, inflammation, or even cognitive fog. Intriguingly, one nut revealed later in this guide may carry compounds that, when eaten regularly, could pose risks to your liver, kidneys, or brain. You might have it stashed in your kitchen right now, praised by diet gurus, but potentially harmful for aging bodies. But don't worry, this comprehensive guide is your roadmap to smarter nut choices, spotlighting the top nuts for heart health, brain vitality, and overall wellness, while flagging those to approach with care. Here's the best part. Stick with us to the end for a surprising revelation about a risky nut that could be silently affecting your health. Drop a comment to share where you're tuning in from, and let us know your thoughts. Without further ado, let's explore 4 nuts seniors should embrace, followed by 4 to reconsider, with smooth transitions to keep you hooked. First up, let's talk about almonds, the bone support superstars. As we gracefully age past 65, our bones become more fragile, raising the risk of fractures that can lead to serious complications. Almonds step in as a powerhouse, packed with calcium and vitamin E to keep your bones robust. Just a quarter cup daily delivers about 97 milligrams of calcium, slowing the natural bone loss that accelerates with age. What's more, almonds are rich in magnesium, a nutrient many seniors lack, which acts like a traffic director, guiding calcium to strengthen bones while keeping it away from arteries. Transitioning to heart health, their monounsaturated fats work wonders by lowering harmful LDL cholesterol, a critical factor as cardiovascular risks climb. For optimal benefits, aim for 15-20 almonds daily, ideally raw or dry roasted without salt. With 3.5 grams of fiber per serving, they're also a game changer for constipation, a common issue affecting around 40% of older adults. Research from institutions like Tufts University adds another layer, suggesting almonds shield brain cells from oxidative stress, a key concern for aging minds. Here's a pro tip: choose skin-on almonds, as their flavonoids supercharge vitamin E's antioxidant effects, doubling their protective power. A quick note before we move on: if swallowing is a challenge, chew almonds thoroughly to avoid choking risks, as their firm texture can be tricky. Now, let's shift gears to walnuts, the cognitive health champions. Ever notice how walnuts resemble a brain? It's almost like nature's hint at their incredible benefits for mental sharpness. These nuts are loaded with alpha-linolenic acid ALA, a plant-based omega-3 fatty acid, more abundant in walnuts than in other common nuts. Omega-3s are essential for maintaining brain cell membranes and supporting neurotransmission, both vital for keeping your mind sharp as you age. A fascinating study in the Journal of Nutrition found that seniors eating 1.5 ounces of walnuts daily for 8 weeks saw significant boosts in cognitive processing speed and mental flexibility. But that's not all. Walnuts' polyphenolic compounds can cross the blood-brain barrier, reducing inflammation and potentially slowing neurodegenerative conditions like Alzheimer's or dementia. As we explore further, walnuts also offer melatonin, a hormone that naturally declines with age, often causing sleep troubles. A handful before bed might just help you drift off more easily. On the heart health front, their arginine and polyphenols promote flexible arteries, complementing blood pressure medications. To keep their delicate oils fresh, store walnuts in the fridge and aim for 7-9 halves daily. Cracking them yourself is a fun way to hone fine motor skills. And don't be put off by their slight bitterness, it's a sign of potent antioxidants. Let's keep the momentum going as we move to our next nut. Next in line, let's uncover the magic of pistachios, the blood pressure regulators. Often overlooked, pistachios are a hidden gem for seniors, especially when it comes to managing blood pressure. With low sodium and a hefty dose of potassium, about 285 milligrams per serving, they help your kidneys balance salt retention, a growing concern as we age. This mineral harmony can lower systolic blood pressure by 3-5 points, offering benefits rivaling some medications, minus the side effects. But there's more to love. Pistachios contain lutein and zeaxanthin, carotenoids that protect against age-related macular degeneration, a leading cause of vision loss after 60. Their softer texture is a blessing for teeth and gums, unlike harder nuts, making them a practical choice. The vibrant green and purple hues of pistachios aren't just eye-catching, they signal antioxidants that combat aging-related free radicals throughout the body. Here's where it gets practical. Shelling pistachios slows your eating pace, encouraging mindful consumption that supports cognitive health and prevents overeating. A study in the International Journal of Obesity notes that the empty shells act as a visual cue, helping you control portions. If arthritis makes shelling tough, opt for half-open pistachios. Aim for about 49 pistachios daily, roughly 1 ounce, but preferably unsalted or lightly salted. With 3 grams of fiber per ounce, they also stabilize blood sugar, a major plus for the 25% of seniors managing diabetes or pre-diabetes. Ready for our top pick? Let's dive in. Topping our list, we have Brazil nuts, the thyroid health superheroes. Thyroid function is often overlooked in aging, but Brazil nuts shine here, making them our #1 choice. A single nut delivers 96 micrograms of selenium 137 of your daily needs, making them the richest natural source of this vital mineral. Thyroid disorders affect up to 20% of those over 65, with symptoms often mistaken for normal aging, but selenium powers thyroid hormone activation, boosting energy, metabolism, and mood. Beyond the thyroid, Brazil nuts' unique fatty acids preserve myelin, the nerve cell sheath that fades with age, supporting reflexes, reaction times, and cognitive clarity. Their selenium is organically bound, meaning it's more bioavailable than synthetic supplements for better absorption. Because they're so potent, stick to 1-2 nuts daily to avoid selenium excess, which can cause issues. Choose and shell Brazil nuts for fresher nutrients and store them in the fridge to prevent spoilage from their high fat content. Their fiber and oils promote digestive regularity, a relief for seniors dealing with constipation, and their sweet, creamy flavor makes them a wholesome swap for less nutritious snacks. Excitingly, emerging research suggests their antioxidants may slow telomere shortening, the chromosomal caps linked to cellular aging, offering potential longevity benefits. Brazil nuts are a small but mighty addition to any senior's diet. But before you stock up, let's pivot to nuts you might want to limit. Now, let's transition to a critical topic. Nuts seniors should approach with caution or avoid, as aging bodies handle certain foods differently. First up, we have peanuts, the inflammation culprits. Despite their widespread use, peanuts pose challenges for seniors. As legumes, not true nuts, they grow underground, making them susceptible to mold and aflatoxins, toxins that can stress the liver and raise cancer risk, especially as detox abilities weaken with age. Their proteins can trigger inflammation, even without allergies, worsening joint pain, heart strain, or cognitive decline risks already heightened in seniors. High in omega-6 fatty acids, peanuts disrupt the balance with anti-inflammatory omega-3s, a common dietary issue. Their vitamin K may also interfere with blood thinners like warfarin, a concern often overlooked by healthcare providers. Commercial peanut butters, loaded with sodium, sugars, or hydrogenated oils, further burden the cardiovascular system, a worry for the 63% of seniors with hypertension. Poor storage can turn peanuts rancid, producing harmful free radicals, and dry roasting creates acrylamide, linked to cognitive concerns. Even if peanuts seem fine for you, try swapping them for almonds or walnuts a few days a week to cut risks and boost nutrition. Let's keep exploring the nuts to watch out for. Moving on, let's discuss cashews, the blood sugar troublemakers. Cashews are beloved, but their high carbohydrate content, about 9 grams per ounce, sets them apart from other tree nuts, potentially spiking blood sugar. This is a red flag for the 25% of seniors with diabetes and 48% with prediabetes, especially since cashews are often seen as healthy. Their smooth shape poses a choking hazard, particularly for those with swallowing issues, and they're among the most aspirated nuts for seniors. High in oxalates, cashews block calcium absorption, concern for those at risk of osteoporosis, and increase kidney stone risk after 60. Processing to remove urushiol, a toxic compound, diminishes their nutritional value, and many store-bought cashews are oil-roasted and salted, adding unhealthy fats and sodium that strain blood pressure and heart health. Their enzyme inhibitors can slow protein digestion, challenging for seniors with reduced digestive capacity. Plus, their creamy texture invites overeating, complicating weight management. For a better option, turn to almonds or walnuts, which deliver superior benefits with fewer risks. Let's continue to the next nut on our caution list. Next, we come to macadamia nuts, the calorie-heavy contenders. Macadamias are indulgent, but at 200 calories per ounce, they're the most calorie-dense nuts, making weight management tough as metabolism slows with age. Their 22 grams of fat per ounce can overwhelm the gallbladder, triggering pain in the 15% of seniors with asymptomatic gallstones. With 3 grams of saturated fat per ounce, they may also raise LDL cholesterol, a concern for heart-conscious seniors. Their hard texture threatens dental health, especially for those over 65 with weakened enamel or dental work, where a bite could cause damage. As one of the priciest nuts, macadamias may lead budget-conscious seniors to cheaper, potentially rancid options with harmful oxidized lipids. Oil roasting and salting worsen their profile, adding sodium and damaged fats. Their rich flavor can spark overeating, particularly for seniors drawn to bold tastes. While nuts are often praised for heart health, high-fat options like macadamias are less ideal. Pistachios, with a senior-friendly nutritional profile, are a smarter pick. Let's wrap up with our final cautionary nut. Finally, we arrive at pine nuts, the medication disruptors. Pine nuts are especially problematic for seniors due to compounds that can interact with over 60% of common prescriptions, like statins, antidepressants, and blood pressure drugs, potentially altering their effects or causing side effects. This risk is rarely flagged by healthcare providers, making it a hidden danger. A condition called pine mouth leaves a bitter, metallic taste for weeks, disrupting appetite and nutrition, with studies noting weight loss in 42% of affected seniors, likely due to aging-related taste and detox changes. Their polyunsaturated fats oxidize quickly, fueling inflammation, concern for those with arthritis. Their small, slick texture raises aspiration risks, especially for the 70% of seniors on meds, causing dry mouth. Enzyme inhibitors hinder protein digestion, and their calorie density, especially in pesto, complicates weight control. Alarmingly, new research links some pine nut compounds to faster age-related macular degeneration, a top cause of vision loss. After 65, it's best to limit or skip pine nuts to protect your health and medication efficacy. As we wrap up, remember that your nut choices can shape your vitality, energy, and mental clarity in your golden years. Small, consistent changes like favoring almonds, walnuts, pistachios, and Brazil nuts while limiting peanuts, cashews, macadamias, and pine nuts can lead to remarkable health benefits over time. Have you experienced changes from tweaking your nut intake? Share your story in the comments. What nut has made the biggest difference for you? Your insights mean the world, and we can't wait to hear from you.